to do it. And the health department became so busy that they put that on the schools and the school nurses to do the contact tracing that they were doing outside of school for us to do it within our community of people. So it's very, you know, it's very different. I can't wait to see 100 kids again a day. All those
Who,
faces.
who knew? And
Who
I
knew?
forgot to hit the record button. Ms. Garner, it's all right if I record
Okay.
this for Jada
That's
in
fine.
case we miss
Sure.
something. So Jada, if you missed something from those first couple questions, let me know. I'll be happy to help. Um, so what type of interactions do you have with workers outside of your office?
Workers like in the school building?
Yeah,
Or
not just teachers, but other employees.
so we do workers comp, like if somebody else is injured, if an adult is injured, we take care of, we have to do the reporting for them, as well through connection with human resources. Um, During the day, people ask us to take their blood pressure, look at their medications,
That's
ask
me.
about family members. Um, we also like if I have any students who, we communicate frequently with the guidance department for any. Our office is always open. The doors here, we don't say no. Like there's never, not that guidance would say no, but the door is never shut. There's always somebody manning the office. So if kids can't get to the guidance office, they end up here. Or if they don't know where else to go, they know that, it's a place that they can come. So we communicate with the guidance, social work, um, administration for policies, um, absences. So we work with attendants every day about who's not here, why they're not here. Um, we have to work with outside people because we have to get immunizations from doctors, kids who are out for medical purposes. We would, have communication with them. We also have a school doctor who we work with that gives us our orders and our directions. Um, this year, my most frequent is the superintendent. We have meetings with her a few times a week and talk to her every single day,
God bless you.
about COVID.
That's pressure. When you're talking to the boss of the bosses, it's not
Every day,
enjoyable.
all day. And I've been here as far as the nursing department. We don't have a head of the department,
Right.
but I am sort of the head of the department. So,
So I guess that's
like
why I thought pupil services would take over that, but they were just like,
yeah, no,
you got it?
yeah.
Okay.
COVID, called
Yeah,
Carolyn.
We got you. God
Yeah,
bless
so
you.
they just, and then Brittany Stewart, who's at Prospect, she's kind of my, she does a lot of the background too with me. I'm sort of the spokesperson, but then Brittany, the two of us are really involved with making sure that it's consistent and we all follow the same rules and communicate with the health department and those kind of things.
That's great. So it sounds like non-technical skills are just as important or more important as your technical skills. Has your computer literacy gone through the roof? Can you describe how that has changed over the last 10 to 20 years?
Yeah. Well, when I started, we hand wrote everything in, every kid that visited the office had like a little card with their name on it. We wrote why they came and what they did. So over the years, now it's all electronic, um, documenting for office visits, but we still keep paper records for their medical records, physicals, thing like that. We have not changed over. Some school districts have started changing over. We do keep our immunizations. Have this year, due to COVID, we had extra nursing staff because they weren't doing field trips and stuff. They were able to enter all of our immunizations into the system. So now all of our immunizations are electronic.
That's
So
awesome.
that was one. We've been working on it. We were up till about fourth grade. Every year kindergarten came, we started entering. They entered them at the kindergarten level. So up till about fourth grade was already done. So we needed fifth and up to catch up. So we were just going to wait till it flowed all the way through because we just didn't have the time or the manpower to get it in. But now they're all in. And this year, my computer skills have really excelled because I know how to I've done PowerPoints and, different, all kinds of Excel sheets and sharing and documents and charts. And so.
That's great. And I understand. I've been there.
Yes.
Was it, so covering a lot of questions. You're doing a great job, Mrs. Gardner.
I can talk.
So I guess considering, you're in the role you are now, coming out of college, did you look to be a school nurse, or did you try a different job first?
When I first graduated, I worked at Children's Hospital. I knew hospital experience was, important. I think that kind of background in for your clinical skills and knowledge and things like that would be important. So I worked at Children's. I actually did nursing home because when I graduated, it was a time in nursing where there weren't many jobs. They go through these fluctuations every few years where there's like, an abundance of jobs, and then there's like, there's this ebb and flow, just like with any profession. So when I happened to graduate, it was slim pickings. So I started out in a nursing home, which I really like old people and I like little people. It's the like middle-aged population that I, glad I never really had to work with. So I did work at Children's Hospital. I worked in the cardiac ICU for 6, 7 years before going full-time to school nursing. I sort of got into it, but I liked it when I did the rotations. I sort of got into it. There was part-time position open. So while I was working at CHOP, I was young. I did some extra, just shifts here. And then I knew somebody was going to retire. So I started getting my school nursing certificate, and I worked on that just within the back of my mind that I might, be interested.
That's great. We appreciate that.
Yeah. So I'm glad I did.
So, what specific science knowledge from college through CHOP through your current position have you carried through and has really been important?
I guess the anatomy and physiology was important. I guess biology, was important.
Especially now.
Yeah. Yes, biology now. I mean, but I was like that chemistry, I guess, when I was doing in the hospital with the different medications, and when I did a lot of infusion stuff.
Okay.
Chemistry would have been important. So I think I've touched on each different, different parts have meant different, different things, in my career.
That's fantastic.
And just kind of, you think back at it, it's not all the specifics of it and everything, but it's a lot of, the concept and the stuff that you did in those areas that you really remember why.
Have you been given any opportunities to like work in any symposiums or any research while you're in here at Interboro?
No, I'm trying to think if I've done anything. I haven't done any. We've talked about doing things with, and sometimes we it's not official research, but we talk about why things that we've done and, specific populations that might visit us, or, reasons for things or why they happen. But not anything we talk about it. We just wouldn't have the time. If we had the time, we would like to say, this is why it's important for doing this one thing, and this is what we might be able to do to improve that one thing.
Right.
Unofficial, we use that, but not.
I understand. I'm just trying to see if we have anything else. Is there what I guess a couple last questions, like if you could think back, is there any like particular advice you could give Jada as she enters Gwinnett or college?
My biggest thing with anybody going to college, I tell I have a son in college, like you have to go to class. You attend, if you're in class and you're physically present and you're doing what is being asked of you, you like, no matter how hard the tests are or how hard the things, if you've been doing it, like people who skip class or don't go or just figure I'm not going to do it, they are the ones who struggle because you miss 3 hours of something, you can't make that. It's so hard to make it up. So just being physically present, is the first, I think, just so important, especially as a freshman, when it's easy to say, like, there's nobody getting me out of bed. There's nobody telling me I have to be there.
Right.
I think nursing is a little different because like the class is going to be small. There's only going to be so many people in there, where when you're in a big major or bigger university, you have that struggle. Like if I don't show up, nobody's going to know I'm not there, but with the small nursing classes, you kind of have that,
Jada, do you have any other questions?
Did anything like ever discourage you from becoming a nurse?
No, Not that I can recall. I'm thinking I pretty much have liked it since I entered nursing.
You
Um,
never had any second thoughts
there was
about your major?
no in the beginning when I worked at Children's Hospital, I worked in a unit where we had kids. There was cardiac arrest and kids died and things like that. And when I had my son, it was very difficult for me in that situation, like to think like about the mother and stuff. And at that point, I not that I discouraged me from being, but it was a difficult time in
Mm.
nursing where I had to just like know that what you're doing is greater than what you're
Yep.
experiencing because somebody else is experiencing it worse than you are.
Yep.
So, but I think that that was a very um, kind of time where it kind of defined that I knew I wanted to do this, but it was a difficult
Mm.
time. But I started out as a pharmacy major, so I made my change before nursing. So I didn't know what I wanted to do, and my dad was a pharmacist, my sister was a pharmacist, my cousins were pharmacists. I just thought I should go to
Okay.
pharmacy.
Pharmacist.
So I changed my mind, and then I really kind of knew what I wanted to do when I made that switch. I think.
I think I am all
So,
done.
yeah, Mr. McGrady came in and asked a question about allied health and course selection. It's just a very busy time. And we appreciate you taking the time to interview with us. I can't think of anything else, like unless you have like a good story you want to share that that doesn't violate HIPAA.
Yeah. Oh,
But
it's
other
always
than,
school
go ahead.
nursing. Everybody always thinks it's that, but it's like a mini ER. You never know what's going to come in, and you're on your own. Like there's not really anybody else to help you. When I worked at the hospital, I worked in a cardiac ICU. There was always physicians and always other nurses. I had monitors telling me everything that was going on. No matter what my bedside looked like, I might only be taking care of one patient. They were waiting for a heart transplant or, just came out of, cardiac surgery. They're infants. It was very significant. You come here, and while it's not like that intense, you just never know. Kids have seizures, adults have heart attacks.
Yeah,
You experience things, and you have to know what to do in your situation to get them out to where there's more resource. Like you have not, you don't have any resources here but your own. So it's a very autonomous job. So it's good. I think getting the experience in a hospital and doing something around people where you can learn is extremely important because I think you learn once you're hands on. That's where you learn a lot of your skills. You really and ask questions and make sure you understand it and get it, and then you have that background. So when you go somewhere and you have to know a little bit about everything, when no matter what comes in, you can kind of direct people in the right way.
Yeah.
that's great. Well, thank you very much. Jada, anything else? Are we good?
No, I think I'm good.
And you can always email me, or if you have anything to add or need a detail or anything, feel free.
Thank
That's great. Thank you very much, Ms. Garner. You have a great day.
Okay, you too. Bye bye.
Bye-bye.